Welcome back to a very special show from Roswell about your breast health. What factors make women more at risk to get breast cancer? Our Courtney Corbetta speaks with Dr. Helen Cappuccino back at the hospital.
This morning, we take you to Roswell Park Comprehensive Cancer Center, a place where they offer a variety of services to keep you informed when it comes to your health. This morning, breast cancer surgeon Dr. Helen Cappuccino joins us, and we're going to talk about the breast cancer risk assessment and prevention program. Dr. Cappuccino, thanks so much for having us.
Hi, good morning. How are you?
Why should women make this a priority? Make this program a priority?
Obviously, it's pretty important to assess your cancer risk so that we can prevent it if at all possible, and certainly detect it at the earliest possible stage so that women can survive breast cancer. Obviously, one of the mainstays of the program is screening, and we can do that with our mammography program. It's a very convenient program here at Roswell. Anybody from the community can come and have their screening done here. I have my own mammograms done here. For women who are at increased risk, there are some additional screening modalities, including MRI and ultrasound, and we have a terrific expert group of women that are reviewing those films to make sure that we detect anything that happens.
Just say you come here to Roswell Park Comprehensive Cancer Center and you go through the program and unfortunately something is found. What's the next step that a Western New Yorker should take?
That's a good question, and people come here in a lot of different ways. They may come in through the program, they may be referred by their primary care physician or their gynecologist, or they may self-refer because they feel something. But obviously an important first component is getting that imaging done to see what is on the mammogram or ultrasound or MRI, depending on what studies have been done. And then occasionally a biopsy will be necessary. More often than not, the most appropriate biopsy to be done is an image-guided biopsy where they put a small needle in after numbing up the breast tissue and take a sample of what it is that they're seeing or what it is that you might be feeling, and then it's sent for analysis. It'll be reviewed by a team of pathologists that specialize only in breast, and based on the findings, either they'll recommend a 6-month follow-up or a yearly follow-up or a consultation with somebody like me who is a breast surgeon. And if it's something that needs to be removed, that's a small operation that can be done here at Roswell to remove it and get a definitive answer or to treat it.
If you're meeting with your primary physician and he or she sends you here, should you bring anything with you?
The most important thing, besides obviously all the necessary paperwork, is really just a good history of what you've experienced. Did you feel anything? Were you having any pain? Does it vary with your cycle? Is there any nipple discharge? Tell us about the lump, how long you've had it, what makes it better, what makes it worse. Is there pain? Are there any other lumps? Is there anything else you noticed with the skin? Any of these things a good doctor should elicit in your history and physical when you're meeting with him or her.
Women in the Western New York community, they can come here to Roswell Park.
Not only can they, but I think they should. They have a great program here. Myself, my mom, my sister, everybody that I love and care about comes here for the breast care, and I like to think we do a great job of taking care of patients the way that I would of my own family.
For those women who are nervous about coming in and getting tested or going through this program, what would you say to them, going through all this yourself?
Sure. Everybody's nervous. Don't let anybody tell you otherwise. There's always a little bit of anxiety. Even if you're going for a very routine mammogram, there's always that concern that something might show up. But there's nothing more elevating that'll lift you up than having the mammogram done and finding out that it's clear. And if something is found, this is the place to be to have it worked up. We've got the experts here.
Thank you so much, Dr. Helen Cappuccino. You heard her. This is the place to be here at Roswell. All you have to do is come in and take that first step. Thank you so much. Now back to you, Linda.
We would like to thank everyone who joined us this morning with this essential information to protect ourselves and our loved ones from breast cancer. If you would like to schedule a mammogram at Roswell, visit roswellpark.org/mammo, or you can call 1-800-ROSWELL, 1-800-ROSWELL. Thank you for joining us. Have a great day and stay healthy.